Hello, this is Dr. Rhonda Johnson, and today is Tuesday, November 24th, 2020. And I am going to give the last part three, of a multi-part video message that I have recorded, in which I respond to misinformation on social media about the COVID-19 virus. So you'll have to check out parts 1 and part 2, and this is the final part. Well, I'm going to start off with misinformation around minority participation in these clinical trials. There's a rumor going out there that minorities and older people were not included in the vaccine trials. Folks, this is false. The truth is, though, that minorities and older people were underrepresented. Now, Pfizer, Moderna, and Oxford University, AstraZeneca have publicly released their clinical trial participant data by race, ethnicity, and age. And you can find that easily by going to any of their websites. But I will just say that I'll just tell you what I've learned for each of these big companies. Pfizer reports that 48% of its volunteers in U.S. clinical trials are between the ages of 56 and 85. They also report that they have racially and ethnically diverse backgrounds, and they had over 150 clinical trial sites in the United States, Germany, Turkey, South Africa, Brazil, and Argentina. Moderna also publicly released its participant data. And according to Moderna's website, they had over 6,000 people who were Hispanic. They had over 25% of their participants were over 65 years of age. They had over 14,000 women. They had 39% of their participants between the ages of 45 and 64. And another 3,000 plus participants were African American. And 29% of their participants were between the ages of 25 and 44. Now, Oxford AstraZeneca says their 24,000 volunteers in their phase 3 clinical trials were racially diverse, with participants from the United Kingdom, Brazil, and South Africa. So please check that out yourself at their websites, and you can find a lot of detail, more detail than I've provided. The next myth and misinformation I want to address is that these COVID-19 vaccines contain something called hydrogels as part of their vaccine delivery system. And these hydrogels will connect to the internet and be a source of artificial intelligence. Well, this is false, folks. First of all, what are hydrogels? Well, they're chemical preparations that swell in the presence of water. Now, many of these hydrogels are already used in pharmaceutical drugs that get delivered on the skin through a transdermal patch. So now, I'm not saying that the COVID-19 vaccine won't come in a patch in the future, because there are over 165 different vaccines in development. And certainly a lot of people would prefer a patch over a shot any day. But the two messenger RNA-based vaccines, the ones developed by Pfizer and Moderna, these have to be given in what we call deep intramuscular injection, a shot deep into the muscle tissue. The Oxford AstraZeneca vaccine also has to be injected. So at this time, the vaccines are not yet released, so I haven't been able to research all the ingredients in these vaccines, but I do know they will not contain any disease-sensing microchips or hydrogels that connect you to the internet. Folks, these are going to be some of the most watched vaccines in modern history. Every side effect will be chronicled, and there will be a lot of information available. You know, the FDA Safety Advisory Committee will be reviewing the data on these vaccines in terms of their safety profiles. And these are some of the smartest people in the world in terms of vaccine research. Now, for the record, I am not a vaccine researcher, And I do not work for any vaccine company, nor have I ever worked in a vaccine company. And I would say my knowledge is probably just a little bit above the average person. Now, sadly, after this SARS-CoV-2 pandemic is over, this is probably not the only pandemic we'll ever see in our lifetime. It could be another coronavirus, an influenza virus, a paramyxovirus, or completely new disease. Who knows? Because one thing we know is that human beings have been interacting with their environment in ways that have never happened before. We are moving, traveling, mixing, exploring. We're even going into space. And very few parts of this world are geographically isolated anymore. So what we learned with this COVID-19 vaccine will probably prepare us for pandemics of the future. So again, I've just been trying to shed some light onto this vaccine misinformation. And feel free to leave me a comment or leave me information on some of the troubling information that you have heard about these vaccines. Folks, it'll be your decision whether you take the vaccine or not. No one can force you to take this vaccine. And I'm hoping that you'll make your vaccine decision based upon information and knowledge of your risk factors. This is Dr. Rhonda Johnson. My views are my own. Stay safe, stay well, stay the course, stay protected, and have a blessed day.